You might be wondering, why is my improvement plateauing? And if so, you are watching the right video today. I want to share some reasons with you why you may not be experiencing the same level of improvement with ketamine treatments as when you first started. I'm Dr. Ko from Reset Ketamine in Palm Springs, California, and I want to help you understand why progress in ketamine therapy can sometimes feel like it's slowing down or even hitting a wall. Concept 1. Let's talk about integrating the experience. One of the most important aspects to keep in mind with ketamine therapy, or really any therapeutic process, is that knowledge alone is not enough. Ketamine can provide profound insights, uncovering realizations or patterns that may inspire you to make changes. But here's the thing, those insights are only valuable if you integrate them into your everyday life. Think of ketamine as a catalyst. It opens up mental and emotional pathways, offering you a window into change. However, without taking action, it's like having a library full of books that you've never read. It's there, but it's not really benefiting you. We like to think of integration as, quote, homework in between the sessions. After an infusion, you may feel more capable of starting new habits or letting go of old ones. This could mean beginning a daily journaling practice, talking to a therapist, reducing alcohol, marijuana, caffeine use, or even just taking time to reflect on what truly matters. Ketamine actually encourages neuroplasticity. This is the brain's ability to form new connections. And this effect is typically strongest in the first 24 to 72 hours following an infusion. When you actively engage in positive behaviors during this window of time, you are reinforcing those new connections. This is why taking action after your treatment is so crucial to long-term success. Next, let's talk about the next idea, revisiting past treatments or approaches. While ketamine therapy can be powerful, it's not a one-size-fits-all solution. Beyond making lifestyle changes, sometimes it's necessary to consider other complementary additional treatments. For example, we've often seen patients who have taken a break from traditional psychotherapy, but after or during their ketamine sessions, they're in a new place, mentally, emotionally, to re-engage with it more effectively. Sometimes adding therapy back in can actually enhance ketamine's benefits because the two approaches really support one another. You may even consider other medications. Maybe they weren't helpful in the past, but just because something wasn't right for you back then doesn't necessarily mean it can't benefit you now. The journey is about finding the right combination of tools that work for you and know that that will evolve over time. The third idea is to know that healing is not a linear journey. It's not exactly from point A to point B in a straight line. Some people will experience rapid, almost life-changing transformational improvements session after session, but then suddenly it hits a plateau. Or maybe it feels like they're taking one step forward and then two steps back. This is normal, and it doesn't mean necessarily the treatment isn't working. Life is complex. Your health is complex, and even the world around you and its complexities all play a role in mental health. You might have some great days, others may be much more challenging. There may be times when ketamine doesn't feel as transformative, and that's okay. What's important is patience, trust, and faith in yourself and the healing process. Please keep in mind that healing, especially mental health, it's often a winding, non-linear path full of ups and downs. So to bottom line it, if you really feel like your progress with ketamine therapy is slowing down, please know that there are ways to keep moving forward. Integrating your insights, exploring additional complementary treatments, and above all, trusting in your journey. If you have any questions or want to learn about maximizing the benefits of ketamine therapy, please feel free to reach out, drop a line, put a question in the comments below. And remember, don't forget to subscribe for more insights on ketamine therapy and mental health.